had that come through.
Hey,
You knew when somebody
Dr.
had it.
Paul, can you wait 1 second?
Of
Because
course.
apparently something happened with the live stream on Facebook. I'm just
Oh,
reconnecting.
okay.
And so if you don't mind, I'm going to ask you to
Happy
repeat
to pause.
that. So let's see. All right. It should be live.
Okay. But when we look at what happened with Ebola, you knew when a person had Ebola. They had a fever. They started bleeding. I mean, the symptoms were overt. You could tell that they were sick. Here, you can't oftentimes, or the illness is mild. And I looked at data about viral shedding, and people who are vaccinated can shed as much virus as somebody who's and minimally symptomatic, as much virus as someone who's very ill. So you have the same amount of particles going out in the community, and that's particularly problematic.
Okay, so it's a combination of the contagious element of the Delta variant and the viral load. Okay.
Exactly. And the thought was that it's because the vaccine made the virus stronger. I had that talk with a few people. That's not the case. If that were the case, everyone who's been vaccinated would be dead. But instead, the efficacy rate is over 99% for severe illness, preventing severe illness. So that it doesn't wash. That's a very specific condition to look at when examining vaccines, and that's not the case here. It's because of overcrowding.
Okay. Interesting. Very good. And we're going to get further into that as we go. Let's shift for a moment to Dr. Tucker. So Dr. Tucker, as I mentioned, for those that are watching that may not know, you actually had COVID and became very, very ill. And you spent how many days were you in ICU?
I was in the intensive care unit for 62 days. I was on Ecmo for 43 days. So yeah, you can get incredibly sick. And one of the biggest misperceptions out there is you have to have already had some kind of comorbidity, and that's not true. I was actually very healthy and actually just gotten a full bill of health from my primary care physician, because I'm used to going on a yearly visit just from being in the Navy. So it's something I had done about 6 months before I got very ill. I took no normal medications other than a Motrin occasionally if I played too much golf. And I got exposed to the virus, and within 8 days, I was in an intensive care unit. You can get very sick very quickly.
So again, just to reiterate, you did not have a pre-existing condition. You were a healthy man.
I was a healthy man. I was a healthy middle-aged guy, maybe a couple of pounds overweight, and that was absolutely it. I had nothing that would indicate that I was going to have a problem like this. I've had other, sicknesses and illnesses, and never got really that ill from it. The regular flu, I would get a couple of days, and that's about it. Body aches and move on. But nothing like this. And the truth of the matter is that no one can predict how sick you're going to get. I mean, I got pretty ill within a couple of days. I thought I just had some bad allergies or something, so I felt like a head cold. And within just a couple of days, I was on oxygen. I went and got my own oxygen from my office and was using oxygen at home until my wife put her foot down and made me go to the emergency room. And within an hour of being in the emergency room, I was in an intensive care unit. Wow. And so it went very, very quickly.
And so can you tell us a little bit, I don't know if we have it later on, but tell us a little bit about the difference between being on a ventilator and the Ecmo machine.
So I was actually on both. My hospital course, when you first get into the hospital with lung problems, you'll get put on a high flow oxygen. And that's like trying to either, honestly, it's like trying to take a sip out of a water hose and then trying to take a sip out of a water hydrant. That's how much high flow oxygen is coming in. I was on that for a few days and started deteriorating. And by Halloween, I was intubated and put on a ventilator and life flighted to Orlando. And then in Orlando, I wasn't awake for many of this really,
Right.
but in Orlando, they put me on Ecmo. And the main difference between a ventilator and on Ecmo, and I was actually on both the whole time up until in the early December when I was finally able to be extubated or taken off the ventilator through my tracheostomy. But the ventilator basically is just taking oxygen and pushing it into your lungs. That's all it's really doing. And then your body's still doing all of its normal work. My lungs were completely whited out, which means they were not working at all. And so they weren't able to even utilize the ventilator. Then the ECMO machine takes the blood out of your body, runs it through a big giant machine, which is basically acting as a lung, if you will. And then it oxygenates that blood and then sends it right back into your body. And so technically, when you're on ECMO, you could conceivably hold your breath and not breathe at all. And you could do that for days and you'd still get oxygen. It would still work theoretically.
Right.
But that's the main difference between the two. And very sick patients are on both. They're on the ventilator and on ECMO, which really, really significantly decreases the survival rate. And that's something that people aren't understanding. I mean, we lost a very well-known individual in our community this weekend, Marc, one of our conservative radio hosts in Daytona. And he unfortunately was getting max therapy and didn't survive it. And anybody that had ever met Marc knows that he was a healthy guy, and he was a jovial, healthy, normal kind of guy.
Yeah,
and
he really was.
Deteriorated quickly.
So sad, so sad. And you were sick before the vaccine came out.
Yes, so I got sick before the vaccine was available. When I was discharged from the intensive care unit. Now, this doesn't get to happen for most people, but I convinced my intensive care unit doctors December 18th to discharge me straight from the ICU to my house instead of going to a regular floor to recuperate. I wanted to be home for my children for Christmas. We're a big Christian family. I really wanted to be home for them for Christmas. So I was discharged December 18th. I was unable to walk. I was in a wheelchair on oxygen through a tracheostomy. My wife wheeled me in December 21st to Advent Daytona Beach, and I got my first Pfizer vaccine dose. And I got my third dose 3 weeks later. So, that's something that I'm really hoping people understand is because you've had COVID doesn't mean anything. You can still get sick from COVID. I can still get sick from COVID. I can still get exposed to COVID and get it and get sick again.
So to the people that would say, and we'll get into the vaccines a little bit more, but, with you saying that, I can hear some of my own friends saying, well, see, what's the point of getting the vaccine? You're going to get COVID anyway.
I would tell you probably the number one thing is that I understand that I can still get COVID, but I have a lot more confidence that the chance that I could die from it now, I didn't think I could die from it last year. Anyone that knows me, that's talked to me, knows that in July of last year, August of last year, I knew COVID was dangerous. I knew these things, but I also knew I was healthy and the chances that I would get sick from it were pretty low. And that was a flat out mistake. And now I know and I even got a booster a couple of weeks ago, thank goodness. So I know that I can still get it and I know it can still make me sick, but I'm very hopeful that with those vaccines that I have enough antibodies in my body that I can actually do well enough and not get terribly ill and not be a burden.
Got you. Thank you. That's very powerful. Paul, how about if we move on at the moment and we go on to Flagler County?
Of course. Why don't we take a look at some of the COVID statistics for the county, and this would be for Bob or Marc. Could you tell us how Flagler is doing with COVID, and in particular the information that you're seeing related to pediatric cases, because that's the main thrust of our discussion today.
Thank you, Paul. I'll do a really quick overview of just a couple of data points, and then I'm going to pass the baton on to Marc, who researched pediatric cases today. So everyone, we are right now in what we call the fourth surge of COVID, and it's unlike any other of the prior three surges. So if we take a point of time, we're going to take the week of July 1st ending July 2nd and compare it to just last Friday. So the week that ended July 2nd, we had a total of 60 positive cases for the entire county. As of last Friday, just 2 months later, 936. If we take hospitalizations just 2 months ago to the day tomorrow, those cases were 9, totaled 9 hospitalizations. Today it was 77. For the last 3 to 4 weeks, we have had cases in the hospital that were up in the high 90s, mid 80s. We are grateful, by the way, that is begin to come down, but keep in mind, our hospital is 132 beds, and 77 of those beds are filled with COVID patients. Number of deaths to date, 164, just 5 deaths over the weekend. Marc Linde, who you're going to hear momentarily, shared with me just yesterday that he had 21 deaths that he needed to process, he and his case investigation team, into our epi database called Merlin. And so that 164 includes the additional 21 cases that still need to be inputted. So it's just both hospitalizations, cases, and deaths have creeped up over the last 2 months. So Marc, if you can share whatever you have regarding pediatric cases in Flagler County.
Hey, Bob, before
Yes.
we move on to Marc, do you know, can you share, because one of the things we hear again and again and again is that vaccinated people are getting sick. Of the cases in the hospital or the cases where people actually end up losing their life, do you have statistics you could share with us that the vaccinated compared to unvaccinated?
You bet. So take the 77 cases today in the hospital. Of the 77, 13 are individuals who what we call breakthrough cases. So individuals who have had COVID or have been vaccinated. And so 13 are people who have had COVID already or vaccinated. They're breakthrough cases. So 13 of the 77. The national statistic is breakthrough cases being, 1% of the total people vaccinated, but I'm sorry, we're not seeing that here locally. I don't believe that statistic. So the percentage of breakthrough cases are significant. So of the 77, 95, so take away the 13, 95% of the remaining are unvaccinated people whose hospitalizations and cases all could have been prevented.
Okay, wow. And what about the deaths? Do we know in regards to that?
Don't have that at my fingertips, but that is something that we definitely can find out.
Yeah, I think there are people that would be interested in that for sure. Thank you for that, Bob. Go ahead, Marc. Sorry to interrupt.
Yes, thank you so much. So you can see when we look at, if I look at the data from July 2nd through July 18th, pediatric cases from age 0 to age 4, we had 5 of them. And then if we go from July 19th to the 22nd, we had 2 more. If we go from July 22nd all the way up until today, we had another 120 cases. So you can see there's a significant increase when we get into August. In fact, July 27th, we had 10 pediatric cases, and it's consistent throughout the month of August, the younger ages 0 through 4, and that goes up even from 4. Our next age group, I think, is from 5 to 14. Then we go up to 958 cases. I'll take out July, and just for the month of August, 795 cases from age 0 to age 14. That's for the month of August. If we just isolate back to the month of July, we go to 160 cases.
So that doesn't include 15, 16, 17-year-olds.
No, the next age group that I can isolate is from 15 to 24.
Yeah, I noticed that. It's really, last year it was so easy to track the data because and I tracked it every day to look at it, but it's really difficult to track the data now the way it's broken out in that age group.
Now, one thing I can do is give you K through 12, if it's working properly.
Yeah, that would be great.
I can give you that for the month of July is 50 cases. And if I add the month of August, 400 cases. Now, this is going to be behind for the last few days as my data system catches up with the amount of cases. So if I look at, and I had this done by Stephanie, from 8/27 to 8/31, just in the last 5 days, this is students in our school systems. We had on the 27th, 47, the next day was 48. On the 29th, it doubled to 80. And every day we've had significant cases. Staff has been lower than that. We've had 4, 5 staff members. So it is actually the younger age groups that are significantly bearing the brunt of this Delta virus.
Great. And David, I know you're tracking these numbers as well. And so where are we today with staff and K-12?
So far year to date, we have 660 students who've tested positive since the start of school year and 71 staff members who have tested positive.
And just for the benefit of the audience, year to date is the beginning of the school year, not January 1, right?
Correct, August 10th.
Yeah. So from August 10th to the 31st, we're at 660 and 71
Correct.
staff. So it's contagious, right? Certainly contagious.
Absolutely.
As contagious as the common cold, as contagious as chicken pox.
Right. I see that. And Paul, are you seeing that in your patients in the hospital? Are you seeing this reflected?
Yes, absolutely we are. I mean, we've been at capacity for weeks
Got you.
now. And that, I remember the last time I was in the hospital that was at capacity was when we had the forest fires and we had to evacuate the nursing homes. That's
Yeah.
the last time I've seen this. And that went on for a few days until the fires were put out, generators were back on, and the patients went back out.
Right.
But this is highly unusual and a tremendous strain on the
Yeah.
system.
Yeah. I remember when we were talking about black status and what that kind of
Right.
means.
Right. We just went to red status today, but the trouble is we don't know what the numbers have started to come down, like Bob said, but we don't know what the backside of the curve looks like yet.
Okay. Dr. Tucker?
I just want to comment because I know we really want to dispel some misinformation as well. Something that's been going around because the hospitals are at full capacity. It's, patients are in hallways in our Halifax system down. They are using pre-op holding areas as COVID units. All right. And one of the misinformations that are out there is that, hospitals are always at 85 plus capacity. All right. So that's an important misconception. One of the most important things to understand is when a hospital system is just operating normally, they will actually take on sometimes a homeless person will come in and just need a couple of days of rest and a couple of days of food and a couple of days of hydration. That's it. All right. Sometimes you'll have a patient that maybe getting discharged to home, they're a little elderly and they're not quite ready, but at the same time, they could be discharged to home. So the hospital will hold on to them for a day or 2 or 3, or sometimes even 4 or 5 extra days, right? And so, yeah, a hospital may seem like it's at 85% capacity, but the truth of the matter is we will get emails immediately when something's happened. And they will say, you need to discharge all of your patients that don't actually need and meet the criteria. So no hospital actually functions at 100% capacity. So some misinformation that's out there is, well, hospitals are always like this. That is an untruth. That's very inaccurate. I have never in my career seen, and that's including in military times in military hospitals, seen hospitals functioning at capacity this way. And that's incredibly dangerous for someone that's going to have a heart attack, or like the military veteran that passed away recently in Mississippi, a gallstone.
Right. And let alone the stress to the doctors and the nurses and all of the other support staff that a hospital has.
You know, that's something that I know we briefly mentioned when we've talked before, and I don't want to get into it much, but the truth of the matter is we are going to have a large number of our community physicians and nurses retiring early because of this. I almost did myself Sunday afternoon because the stress of seeing a positive COVID patient that has high viral load in an intensive care unit is immense, and I'm not prepared to leave my children because of that.
We're seeing, you know, we've got concerns as well in the education field. We had a large number of teachers retire and staff retire, support staff retire last year because of concerns. And, you know, just the proximity and the danger and the worries of catching it or bringing it home to a loved one or an elderly parent that they care for. So I think we're going to see in some of these industries, you know, the education sector and the healthcare sector go through some growing pains in the future. That's going to have to be addressed at some form or fashion. We were talking about data and transparency and being able to access data. And that's been one of the frustrations that a lot of folks have had. Can you share with us, Paul, a little bit about what is going on with the data?
The biggest problem that I see that I encounter is the lag. It takes time for the data to get compiled. It takes time for the reports to be processed. It takes time for them to be put out. That's no fault of our colleagues in the public health sector because they have such a volume being unloaded on them now. And that's a problem. But at one time, you used to be able to, as you alluded to earlier, look on a dashboard and see vaccinated versus unvaccinated, ages, comorbidities, et cetera, and we don't have that data readily available. I get a report that shows how much of the hospital is full, how much of it is COVID, how much of the intensive care unit is full, and otherwise for the public data, I have to kind of pick through it to get that, and I know that can create some anxiety with people, and that's why I'd appreciate it if either Marc or Bob would be willing to step in and give us the nuts and bolts of that.
Sure. So Colleen and Paul and everyone, for the first 15 months, 16 months of COVID, we would get 11 different daily reports that covered everything from number of cases, hospitalizations, deaths by age group, vaccination by age group. I mean, 11 different reports, and that we would have available to us at the health department to share with media outlets and people interested in knowing what was going on. And then all of a sudden in June, the spigot was cut off. On statewide calls that I participated in with other health officers, including the Surgeon General, Dr. Scott Rifkes, I asked, listen, the biggest lesson learned during the 1918 pandemic flu was the importance of knowledge, data, information, so that we can squelch information that is disinformation and squelch the falsehoods. But when I said, please, we're now in the fourth surge of this pandemic in all of our communities, data is more important now than ever. And all I heard was crickets. And I got no response whatsoever. So I want our community to know that I, as health officer, I'm not pleased about that. I'm actually disappointed about that. And when I talk to my colleagues in Tallahassee, again, there's no answer. We get a weekly report at the end of each Friday that Marc and I get, and it's basically number of people vaccinated to date and number of cases to date over the last 7 days and people vaccinated over the last 7 days. So if someone does ask for information, we got to dig. And Marc has to take his time, he and his staff, to dig into our epi system called Merlin to find the information. And listen, I'm being totally transparent here that is very unfortunate.
Yeah, I remember back in June because, like I said, I was tracking this data on a regular basis.
Yep.
And, towards the end of the school year, we were all very excited, with the numbers and what we were looking at. And when we moved to optional masking, I think everybody felt a sense of relief that this was okay. But unfortunately, the data I was looking at, I kind of felt a little hoodwinked, if because I kept saying to people, well, the numbers are going down and, these numbers might be going up, but the bottom line is, you know what, the deaths, they're flatlining. It looks good. This is all right. Well, the reality was they weren't reporting the deaths. So you weren't able to see what was happening, especially drilling down that data to the county level.
I believe, Colleen, I believe the deaths are being reported. Paul is right. There is a lag. So we are capturing all the deaths because deaths can occur from a hospice, hospital, nursing home, someone passing away from COVID in their home. So no, we are capturing the deaths. I'm just talking about data in general that was very, very accessible to the public and to us. That is my biggest concern. And I'm not blaming my colleagues in Tallahassee. I will tell you, though, that more is at play here at higher levels, and I'll stop right there.
That's good. That's good, Bob. We're gonna
I want to keep my
this
job.
non-political. That's right. Thank you. All right, we're gonna move right along then. Okay, but the point is well taken, and it's one that we can't ignore. I mean, the reality of the situation is everybody understands what's happening, and with
Data
that,
is powerful.
we'll continue to move forward. So let's talk about safety protocols. How about that? Paul, you want to start with the
Sure.
next one?
Bob, would you be willing to touch on some of the safety protocols that are recommended by the CDC and by our local office?
Sure. I mean, the two big mitigation strategies, everyone, for safety for our children, our students, our staff and teachers, especially our children younger than age 12, where there's not a vaccine for them at the moment, is the two biggest strategies, right? For those over the age of 12 to choke the chain of transmission, please get vaccinated. Yes, we've been saying this for the last 18 months, but with Delta all around us, that is absolutely critical. Number two is wearing a mask. Wearing a mask, this follows CDC guidelines, and wearing a mask in crowded places where social distancing cannot be practiced, especially indoors, we should be masking because that is the other way. Despite what the anti-maskers and other folks say, masks are 80% effective, some kind of facial covering, 80% effective in stopping the transmission of the virus. Studies have been done many, many times comparing different parts of the country. And the data is it's quite clear that yes, wearing a mask is important. Such an unobtrusive, less costly mitigation strategy. It's real simple. So those two things, vaccinations and wearing a mask. And I know that David, in the school system, right, David, you guys have instituted a lot of safety measures as well.
Yeah, absolutely. And just kind of hearing the conversation and Dr. Conklin mentioned it, one of the challenges we face as a school system is that there's a lot of guidance out there and there's a lot of recommendations provided from the federal level, the state level, the Department of Education. And one of the things we have to do is try to navigate through that guidance because it doesn't always match up with each other. Sometimes it conflicts with each other and so school districts are left with a decision to make and what's the best course of action, to implement on your campuses. And one thing I've learned throughout all this is don't try to figure it out and don't think it's behind us. As Dr. Conklin mentioned in June, we were talking and we thought for sure it was, the worst was behind us. And I remember even meeting with Bob and Marc in a meeting and kind of discussing, are we really going to need this next school year? And then the summer came and obviously things, changed and definitely not for the better. But as far as this year, we do have a return to school guide posted on our website and it's been updated even here in the past week. but some of the things we're doing to put in place is there's a major focus on improving our HVAC units. That's been a major project kind of going on behind the scenes the past year and a half. We use some grant dollars to help upgrade our HVAC systems, running more air, having more air changes per hour, increase our air filters, as well as, last year we made an investment in increasing our cleaning equipment to have disinfecting machines on all of our campuses and a number of them for our school buses, and all of our buses and campuses are getting entirely disinfected every other week, but also following those CDC recommendations. If you're alerted of a positive case within that 24 hours, to make sure that room's getting disinfected. But on top of that, we're cleaning every classroom at the end of each school day, and we're cleaning high touch points multiple times throughout the school day. And when we say high touch points, it's focusing on your door handles, your common area, front desk areas, tables in the cafeterias and things like that. Some of the changes we just put in place just due to the numbers is we opened up the first day of school and we allowed visitors on campus with the hope that we'd be able to do that successfully, but with the number of cases we're seeing not only in our schools but in the community, we recently suspended non-essential visitation. A lot of questions come up as far as, well, what does that do for mentoring? Mentoring is a major part of our day-to-day operations with our students. So if they cannot meet virtually with those students, we are still allowing our mentors to meet with our students at this time. We also looked at our indoor capacity for extracurricular events, and we reduced that down to 50%. Like I said, to start the school year, it was full capacity, but now is not the time to keep it at full capacity. So we're really limiting those extracurricular events. We've increased our outdoor eating areas and working on ways to increase our creative learning spaces for our students as far as outdoor spaces and things like that, that we continue to add on as we go out throughout the year. But like I said, these protocols in place, they're something we're monitoring constantly, paying attention to what's happening, from the federal level to the state level, and what DOE is pushing out to us, and it's always going to be changing and ongoing. So I encourage everybody to, stay in touch with us through social media, check our website. That's where the most up-to-date information is. And we'll continue to make changes as we need to.
Excellent. Thanks, David. And I know, I don't know, you might have mentioned it about the heavy duty machines we purchased for the buses, because I know there's a lot of concerns about the buses. Did you mention that? Yeah,
so we purchased Clorox 360 machines for each school campus, and then I'm not sure the type of machines, but similar machines for our buses, to where we can completely go and disinfect our buses. Every bus gets completely disinfected every other week. But if we are notified of a case, and if it's within that 24-hour time frame from when that student who was tested positive for COVID was last on that bus, we'll do a complete disinfectant for the bus following the CDC guidelines as far as disinfectant.
Right. And again, I would say to parents and to families, especially on the bus, and of course we're not in the place where we are able to mandate masks right now and require them for everybody, but I would strongly encourage your children to, at least at a minimum, when they are riding the school bus, to please wear a mask until they get to school, just because of the numbers and how close they are together on the bus. So if we could, thank you for that, David. And I think we'll touch a little bit more on protocols as we go. I'm going to back up to a little bit of what we were talking about masks and vaccines. There is, of course, a ton of debate around the efficacy of both, but specifically this conversation around masks has kind of taken on a life of its own, which is amazing to me. But in fairness, can we talk a little bit about that? Because there are, I know people have sent me other studies about the efficacy of masks, some studies that say masks don't work. People talk about, aren't the masks just as nasty and dirty? And won't they just, spread? They're holding, they're just nasty. And people talk about the study from the Florida, I think it was Florida State.
Florida, FAU.
Thank you. So could you talk a little bit about masks and share with us a little about the relative science behind masking?
One of the things that everyone wants to quote, and I mean, I look back at it a year and a half ago when this started, is the size of the viral particles and how they can transmit through the mask, and that masks do nothing. That's all incredibly false. All right. So yes, the viral particles can go straight through a mask. That is 100% accurate. However, the viral particles are not just floating free in the air. They're floating in your respiratory droplets. When you sneeze, when you cough, when you're breathing, and your moisture is larger. So the viral particles are trapped in that. And so does it prevent the transmission of those viral particles 100%? Absolutely not. Absolutely not. All right. A seatbelt doesn't prevent you from dying in a car wreck 100%, but it gives you a pretty good shot. A mask is the exact same thing. It's not going to prevent the transmission 100%, but it's going to cut it down. All right. And about the dirtiness of the masks, well, the truth of the matter is that that's your own respiratory droplets. All right. If you're putting the mask and touching the outside of the mask, then you're doing it wrong. All right. The mask should be cleaned every day. If you're using reusable masks, they should be cleaned every single night. All right. It is very inexpensive to buy a pack of 5 masks, wear a clean mask every single day, and then on Friday evening, Saturday, wash those masks and redo it again the next week. So there's been no data out there. Even the FAU study actually shows that, the masks help prevent that 12-foot transmission from respiratory droplets. When the truth of the matter is when you sneeze, for the most part, it's a 3 to 6 foot range. But masks do a very good job of keeping your respiratory nastiness, as you described it, in. All right. It keeps it right here. So when you sneeze into your mask, yeah, it's gross, but it's your sneeze.
Right.
It's your viral particles or whatever you've got going on. So that's where the masks come down at. I mean, the fact of the matter is, I can't imagine the guilt I would have if my 14-year-old son got COVID and got very sick, and it's because I didn't want him to wear a mask. No, thank you. I think that's absolutely ridiculous, right? They get in the car when they're toddlers and they didn't want to be in a car seat. I don't care. It's protective for you. That's what you're going to do. And that's the truth. That's what masks do. They give you that extra layer of protection, and they help protect your neighbor. That's really what they're for. Now, when it comes to vaccine efficacy and the vaccine, well, I think people are looking at it completely backwards. It's simply amazing what science did and came up with a vaccine that quick. I'm tired of hearing all this other nonsense. I think Bob spoke and said we have 77 patients in the hospital from COVID. Bob, how many people do we have in the hospital admitted for a complication from a vaccine?
Nobody. That is
nobody.
Right. Nobody, Dr.
Right.
Nobody. 0.
That's exactly right. And that's the truth. And that's where it comes down to is, yeah, there was a patient that died in New Zealand 2 days ago from a vaccine. That happens. Vaccines can cause anaphylactic reactions. The chickenpox vaccine can, MMR can. Those things happen, which is the reason when you get the vaccine, even as a doctor, I had to stand in Bob's office for 15, 20 minutes talking to him. I liked it, thank you. But I had to stay there for 15 to 20 minutes to be monitored to make sure I didn't have a reaction. That's the way that works. My 14-year-old and my 16-year-old are vaccinated. They will continue to get boosters if that's need be. masks and vaccines are all you and I can do. Dr.
Well,
Mucciolo, is there a treatment for COVID? There's no
There
treatment,
is
right?
not. And I'm glad that you touched on that, Dr. Tucker. I have been a reader of the medical letter on drugs and therapeutics since I think my first subscription was 1994. It used to come out once a month. Then it was once every 2 weeks. Then it was weekly. Now it's daily. Now we get updates hourly because of COVID. The medical letter has opened up its monograph, I apologize, for COVID to include all the treatments. Yesterday it was 242 pages. Today it was 247 pages. I read through them to skim them. No treatment. I've heard the fallacy, the therapeutics are 100% effective. Not true. Not true. We can talk about monoclonal antibodies, but the way to stay healthy with COVID is to keep yourself healthy, but also to get your shot, wear your mask, wash your hands, and don't touch your face, and stay away from people. Even when you're outside, if you have to cough or sneeze, step away. When COVID started, I'll never forget it. I walked in to see a patient, and I was fully masked and gowned because she had symptoms consistent with what was being described. We didn't know much about it at the time. And the lady had a mask on, thankfully, but she coughed and pulled her mask down and coughed right in my face. And I held my breath. It was 2:00 in the morning. I held my breath, ran around the corner into the physician's bathroom, stripped off all my clothes, and turned on the shower. Because I had no idea how this was transmitted. I didn't know if it was on my skin. I didn't know if I was breathing it in. But I'm sure as heck not going to take that home, potentially asymptomatic, and infect my children,
Right.
and infect my wife, and infect my family. So no, there is no treatment for this. And I've heard about the medications that we could get off on a tangent about this that are primarily for veterinary use and malaria. And now they're talking about antidepressants, et cetera, et cetera. I stay in a narrow lane. I read everything, but I stay in a narrow lane because my patients deserve something that's going to work. I'm not going to make them sicker. I'm not going to give them liver failure. I'm not going to put them into a heart rhythm with hydroxychloroquine that I can't reverse. So that's the primary thrust of what we have to do, which is take care of people and educate them as to what works and what doesn't work.
The reality is too, for some people, and I probably was in that category for quite some time, is it's fear. People are afraid. They think that there was a rush for the vaccine. They may not be vaccine friendly to begin with, and this just adds to it. My son didn't have he had a terrible reaction to an MMR vaccine, and he has ITP. So we, as a family, we were very concerned about getting the vaccine, and probably pretty late to the game. But given the alternative and looking at the statistics, and knowing, yes, you could get the vaccine, there could be complications, you could have a breakthrough case, but statistically, you're probably not going to die. That was a game. That was all it took. And so let's understand and recognize people are truly afraid. There are some people that are just honestly, they're afraid, and they're reading everything I researched everything I could possibly research. I looked into everything I could possibly looked into, and I went with the Pfizer because everyone in the medical community was doing Pfizer. And so that's what that gave me a level of comfort. But I think a lot of it is fear. And Dr. Tucker, I think you mentioned something last night when we were talking. People want to hear something that is going to make them feel better about the decisions they make.
That's exactly right. I think what we get, I think there's a very small vocal minority that still are this, COVID's a hoax, I think the vast majority of the people that aren't vaccinated or are not wearing masks are because they're confused. And it's not for any other reason. They're just not sure what's really out there and what's the truth. All right. And I think when you hear things like people taking an anti-parasitic drug for a virus, the first thing I can tell you is don't go to that doctor because he didn't do well in medical school, because a parasite and a virus are like worlds apart. All right. The other side of that is I would have taken it if it worked. I mean, I care a great deal about myself. I would have taken it if it worked. And the truth is that I would have a ton of it at my house, because if my kids got sick and it worked, I would give it to them. We can always find someone to tell us what we want to hear. If you want to be told that masking violates your medical rights, or you want to hear that masking will prevent a child from learning how to speak correctly, I can find you a doctor to tell you that. The truth of the matter is none of that's true. 96% of physicians are vaccinated. 100% of politicians are vaccinated. All right. And the truth of the matter is we can always find someone that'll tell us what we want to hear. But what we want to do is do what's right. All right. If vaccines were bad for us, Dr. Mucciolo wouldn't have one, I wouldn't have one, you wouldn't have one. None of us would get them, right? We would try to convince you to get them. That makes no sense to me at all, right? What we're trying to do is make our community safer. And if that requires me to wear a mask when I go into Publix, I can handle that. Because my grandfather, he was able to do things that he needed to do in World War II to keep his fellow Americans safe. So I think I can wear a mask in Publix.
Yeah, it's amazing. I had a conversation with my dad, and he's 90, and he had TB, and him and my grandfather were taken and put in a sanitarium in New York for a year and a half with TB. And I said to him, well, did you refuse? He's like, no, there was no. Well, what do you mean you went the whole time? Yeah, they were all over the country. They had them everywhere. And if you had TB, you had to be removed from the population. I mean, I'm not saying I support that, by the way. I'm just saying it was a different mindset, because in order to save people in their own community, in their own home, they knew they had to protect others. So let's move, because we're running out of time, and I so appreciate this conversation. And we will be going over a little longer because we started a little later, but let's shift to quarantining, because we have so many questions about quarantining, and I'm hoping that we can shed a little bit of additional light on that. So there seems to be a lot of confusion. Marc, Bob, can you review what the quarantining requirements are, how contact tracing happens or should happen, and all the rest of it?
Colleen, I'm going to ask Marc to take this. Marc oversees our case investigation, contact tracing initiatives. Stephanie Ear, who you all know, or many of you know, is our school health coordinator. Stephanie reports directly to Marc. So Marc is prepared to answer this question. And so Marc, thank you. And by the way, my computer says it's going to shut down in just a couple of minutes. So I'll reboot it. And so Marc, please, thank you.
All right, thank you so much, Bob. So there's been several changes in the quarantine isolation recommendations that came down from the CDC since the beginning of COVID. Initially, it was 14 days. That changed, I think, towards the end of last year when they made some recommendations to 10 days. I think that was based on, number one, how much it spread from day 10 to day 14, and number two, how much people were listening to the recommendations. And they said, listen, if people are not staying for 14, and from day 10 to day 14, there's really not as big of a risk, let's change it to 10, and we'll get more people to follow what we're saying. And that was the biggest thing. You can have all kinds of rules, but if nobody follows them, then they're no good. So coming up to the beginning of the school year, because I think that's what everybody's very interested in. The Friday before school was to start, we had a recommendation. An emergency order came down from the governor of the state of Florida. The Flagler County Department of Health did not make that emergency order. That came from Tallahassee, and it had some changes in it. So as the Department of Health in Flagler County, we reviewed that, and those changes had recommendations for students. At that time, the Delta variant was already increasing in our community, and those changes were made, number one, so that people would follow them, and number two, so that we could have people in the classrooms. And it was also based on how fast this Delta variant spread. So the change was to have students in public schools, this is directly from the emergency order, if they were a known case of COVID, to isolate for 10 days, okay? If you are a close contact, because that's where a majority, I think the number is over 2,000 close contacts of known cases now in our public school systems. So if you were a close contact within 6 feet cumulative throughout the day, up to for 15 minutes, then you would go home and isolate for 4 days, minimum. You had to stay home for 4 days. On the fourth day, if you are still asymptomatic, you have no symptoms, you had an option. You could go to any one of many providers. The Department of Health offers the testing, and you could have a rapid test that would determine if you had COVID-19 at a high enough level where you would be catching the disease. If you were negative on that test and you were asymptomatic, on day 5, you could return to school. Now that has caused a lot of confusion. This was a new guidance meant to keep kids in school. Last year, we had kids staying home. We had, in-home schooling, and they wanted to allow kids to stay in school. So the other part of this is if you do not want to participate in the rapid test, you say, no, I don't want rapid testing for whatever reason, your choice. Your child can stay home for 7 days. And if they're still asymptomatic on the 8th day, they can return to school. Okay. Again, if you have COVID, you need to isolate for 10 days. You can return to school if you are then asymptomatic after your COVID infection. So
And
these.
Mark, can you explain too how contact tracing is done after you explain the nuances about this rule?
Absolutely. So there have been, and we've recognized due to the rapid increase in Delta cases in just our schools. Remember, on day 1, we had 0 positive cases in our schools. Nobody went to school with a positive case of COVID. And now we've determined how many we have up till today. What was the number, David?
660.
660.
660.
So 600, I'm sorry, David, I put you on the spot there, but that is from the 10th to today, which is the 31st. 660 cases. At the height of the COVID pandemic, my case investigation team was working at the height, just over 100 cases. We are now having, today was 159. We have doubled, sometimes we've been over 200. And our student cases have been 80. So the entire county before, our students have had that many cases. So my case investigation team, when they get a report of a positive case, they contact the positive case and they contact the close contacts as quickly as possible. Now we have to get the names of those children so we can call them. We have to be able to get a hold of their parents and discuss it. That's been a struggle. Everyone has heard about the difficulty in hiring people. When I started on August 10th, we had 14 people in our case investigation team. The average case investor can handle over 10 cases. So we should have been able to handle at least 140, but we've had up to 200 and we've had more than that. And our school cases have doubled. On Saturday, we had 48. On Sunday, we had 80.
So just to put that in perspective for folks, right, Mark?
Sure.
And we talked a little bit about this last night. Gretchen was mentioning this. How many contact tracers do we have?
So we've changed last week. Currently, the Department of Health has put an all hands on deck. So if we need more people, then we call people that are working in the clinic, or we've had people working in our dental clinic. Everyone is helping so that we can call as many people as quickly as possible.
Right, because what what Gretchen was saying is, I think we were looking at 8 at that point in time. But if you take that, you take the caseloads and you multiply that by the number of individuals that need to be contacted, I think the number was somewhere around 2,400
Yes.
individuals needed to be contacted. And when the perspective of that happening with 8 individuals is, I mean, that's a task that almost becomes impossible. So some of the questions that have come up are, how can we help? What can we do? Is there something we can do to help? I know that some of the teachers feel obligated to share, and David, you can talk to about whether they shouldn't or they should, but I know that many of the teachers, when they know that there is a positive case in their room, to share that information, they feel obligated. But if there's something we can do to help lighten the load.
I think, Colleen, if I can just address one thing, and this is a large problem that we've had, and I understand the struggle. It is very hard for some of our parents to have children home if they have a job. And not everybody can. I'm sorry, it's freezing. Can you see me?
Yeah, you just froze, but go ahead.
Okay, so it's very difficult for parents to have their children home from school from a financial standpoint. A lot of parents can't afford to stay home. The problem is if we don't get them the parents don't tell us the truth. Hey, Johnny in school, his sister's here as well. And the sister goes to a different school, and she goes to school, and she may not be symptomatic, as many children are not, but she has COVID, and she has the Delta variant, and she's sitting surrounding a classroom of kids. You can see how quickly this can spread.
Right.
A lot of parents are angry, and a lot of parents are confused. And our case investigators are doing the best they can to explain the situation the way it is. It has changed. This Delta variant has forced us to change, but that doesn't bode well with everybody. So I think,
David, while he's unfreezing, do you want to share a school perspective?
Yeah, first off, I got to thank the health department, and she's not on here, but Stephanie here, and those of you who know me know how much I brag on Stephanie and how hard she works. I can assure you they're working probably 24/7. One piece of advice I would give to our families listening, and even our staff members, if they're tuning in, is, the health department, they don't stop. They're calling on weekends, they're calling on nights, and they're doing this, so we're not adding that additional risk to our campuses in the mornings. And I know it's a hassle and nobody wants to answer their phone on nights and weekends, but answer their calls, give as much information as you can.
Absolutely.
We've spoken this week, and we have more meetings scheduled that we're trying to collaborate on ideas. How can we help each other out? And, as a school district, the onus is on us too, is how can we get this message to our parents and our staff is, listen, these people are going to be calling. We strongly encourage you to answer. And also, how can we make that easier? What's the best way to get that information, from us to them in a timely and confidential manner? So those are things we're trying to work through together, but I got to say it's definitely not on a lack of effort from DOH's part. They're nonstop working to try to make our campuses as safe as they can.
And just to clarify a few things, and some rules that the Department of Health has to work under. If you call a family, my understanding is you cannot share with them the who, the where.
That's correct.
Right. You can't give them the specifics about the positive case. Can you even tell them specifically, yes, your child has 100% been in contact with a COVID positive case, or do you have to couch it in the terms of your child may have come in contact with a positive COVID case? Is there lines to be drawn there? Because sometimes I have heard from some parents, well, they said May.
So I hope I don't have any more problems with my internet. I don't know why that was going on, but I will tell you, there is no 100% when you're doing contact tracing.
Right.
We are giving lists of names that teachers have identified as being a close contact, either in the classroom or in the activity. And we go by that. We're not there in school. My case investigators, my nurses, the people making these phone calls are given this list from people who work in the school system, and they are doing their best to try to mitigate the spread of this horrible virus.
But legally, you can't say your child contacted,
Correct.
was in contact with a case in gym.
Correct.
or
We can say your child was in contact with a case at school, but we cannot give them the name of the child, when exactly it happened. We just say at school. We were notified that your child was a close contact of a known case.
Right.
And we can tell them the day, because that's how we determine how long they need to stay out of school.
I think there's some frustration around that protocol. People naturally, they want to know those things. I'm going to run down a couple of questions so that we can get them on the floor and we can get some answers for folks. So David, this one would be for you. Can teachers notify close contacts once they're aware of a positive case in the classroom, or do they absolutely have to wait for the health department to call?
They need to wait for the health department, and they, Bob and Mark probably correct me if I'm wrong, because there's probably a lot of follow-up questions that's going to come from that notification to the parent that our teachers aren't trained to properly address.
Okay, so another one. If a parent gets an email from a teacher, from a child's teacher, should they quarantine their child or wait for the health department call? Same kind of question, I guess.
I would encourage that parent to reach out to the school administrator so they can get more information to make sure it's accurate. And then we obviously we have a liaison with the health department. We can get clarification on that. But it's definitely something to look into. We just want to make sure it's accurate, and that case is actually confirmed with the health department. I do want to remind everybody that we work off confirmed cases through the health department.
Okay, and I know that some parents have actually been forthcoming and sharing on social media, hey, my child is in so-and-so's class. I just want everyone to know, if your child's in this class, my kid has been positive for COVID. And of course, we can't control that. And, and in many ways that may actually help in those cases. So another question, what if the exposed student tests negative? Can they return to class, or do they have to wait the entire quarantine time?
So they can return to class as long as they're asymptomatic on the 5th day. So after 4 days, if they test negative on the 5th day, according to the governor's executive order with the school and the Department of Health and Flagler have adopted, they can return to school on the 5th day. We do have parents coming on the 2nd and 3rd day saying we would like a test and go back to school tomorrow, but we have to wait until that 4th day, and on the 5th day they can return to school.
Okay.
As long as they have no symptoms.
And what about siblings in the household?
So siblings that go to school, or?
Well, let's say my brother lives with me and he has COVID and he just came back positive.
So that's a very good question. If you cannot isolate from people in your home, every day that you're around that person, your isolation period moves another day because you're exposed to them every day. So let's say that you are in the home and your brother has COVID and he is in his 10 days of isolating from everyone, and you're around him every day. You have to literally stay quarantined for those 10 days, and then your 4 days starts after that 10th day, because every day you're around him, you're exposed to a positive case.
Interesting. Wow. Okay. All right. I think those were most of the quarantining questions, although I have a feeling we could ask a variety of scenarios around quarantine all night long.
We have a lot of confusion with that because parents have to take care of their children. So if you cannot isolate from your child and you're positive, your child has to stay out of school during your entire 10 days. and then an additional 4 days so that we can see if your child is going to come down with COVID.
Right,
It-
right. And so let's talk about testing. Let's move on to testing. And I'm so sorry I'm abusing your time with me this evening, but I want to make sure that we get to some of these pieces. So let's move to testing. And Dr. Tucker and maybe Paul, if you can talk a little bit about the differences between the rapid test and the PCR test. And, you know, some folks are saying we're seeing a surge only because we're testing more children now.
Well, the test, the one thing that I'd like people to understand, I got a whole list of comments that I responded to. I have written. I saw one comment that said, my doctor told me that the PCR can't determine between the flu and COVID, and that's wrong. The test that we run can do a bouquet of things. I can test you for COVID. I can test you for flu A, flu B, RSV, and then we have a special respiratory panel we can run for pediatrics. So I have 5 options and various combinations of those, depending upon the clinical picture, to try to nail down what exactly is wrong. The PCR test gives you a molecular fingerprint of the virus. So if that's positive, it's positive. I've given people their results in the department and they go into denial mode. That test isn't right. That can't be me. And it is correct, and it is you. That is your swab. So they have to understand this, because then the mind starts to spin about the contacts and the quarantine, et cetera, et cetera, et cetera. So I understand that. And that goes back to what we alluded to earlier about people being afraid.
Is
And
one
that's
test better
perfectly
than the other?
understandable. The PCR is the one that I recommend. And that's the one that we run. And it's fast now. When we first got the test, it used to take 6 hours. And that's an eternity in the department.
Yeah.
Then it became 4, then it was 2, now it's down to about an hour, which
I
is
think
really good.
One of the really important things to understand about the testing for parents is a negative, if your child is exposed to COVID today, a negative test tonight or tomorrow means nothing. It can take up to 72 hours to convert to a positive. And that's where, when Marc keeps saying the negative test, still 4 days of quarantine, and then the 5th day you can return with the negative test, it's because of the conversion. So going out and getting a negative test right away isn't going to help unless they're actually having an active issue. But if you get a PCR, if you get exposed tomorrow morning and you go and try to get a PCR test tomorrow evening, that PCR test can still be negative and you can still have the virus. It can take time to convert to positive because the viral load will have to increase. And that's just the way all the testing works. And that's where those days come in. So testing your child right away, I mean, I test a lot, but testing your child right away, it doesn't necessarily mean that they don't have COVID. And that's where the 5 days of asymptomatic and the 4 days before you get a negative test, before you can return, that's where those numbers come in, is because of the conversion of actually a positive test.
Colleen, if I may, we need to make a very important point about the rapid test. I don't know if that is where you wanted to go next, but yes. So Dr. Tucker, Dr. Mucciolo, they're absolutely correct. The PCR test, that molecular test, is the gold standard without question. However, the Abbott rapid test is an excellent test. It is very sensitive and it's very effective to catch the contagion, to catch the virus during its most infectious period of time, which is a 10-day period of time. So that's why we use it. That's why professional sports teams, basketball, football, I mean, the Olympics, everyone has been using the rapid test for the last 16, 15 months. And so we count on it a lot as a surveillance tool for obviously getting a child back into school sooner rather than later, because again, that is a very effective, sensitive test. And that's why we're offering testing at the health department 7 days a week, 8 to 12 noon, every single day at Cattleman's Hall at the fairgrounds. Is because, and we're doing 200 a day, but no, the rapid test is very much in use. Again, very sensitive, very, very effective, and it works extremely well.
Okay, thank you for sharing that. And I think there's some confusion, you know, we talked a little bit last night. One person in the family could get it and nobody else gets it. You know, one person converts and everybody else is fine and isn't contagious. Dr. Tucker, you want to talk a little bit to that?
Yeah, I want to go back just a second because there's a lot of confusion on the chat here with this hour for the PCR and how long it takes to get back. That's not the point. Is it takes an hour when you go to the emergency room and you are symptomatic and you're getting tested, or it's been 3 to 4 days since your exposure. But it doesn't take an hour from the time you're exposed to convert to positive. That's not what that means. It will take 72 hours at least. That's the reason there's the 10-day time frame, 72 hours at least to convert to a positive test. If you are blasted with virus right this second, 5 hours from now, you go get a PCR in the ER, it will be negative. It will take 72 hours before your body will convert to a positive. And then you get the test and it takes an hour and you get told, there it is. Now, as far as Bob was speaking about the rapid test, I do those constantly at my house. I test myself pretty routinely from being exposed to positive patients when I'm on call or whatever. So that happens quite a bit. And I do agree with Bob about that test. Now, we don't know the answer to your question, Colleen, about why some people will all of a sudden convert and others won't. That's something that's going to take a long time to get a lot of that research compiled. I converted and I stayed in my house, not knowing what was wrong with me for several days, very sick on my couch, and neither of my teenagers nor my wife converted to positive. And they were under surveillance by Bob and them at the health department when I was admitted to the hospital. They were quarantined for 2 weeks back then, and they were tested a lot, and they never converted. And so we don't know the answer to that specifically. And that's probably data that's going to come a lot later.
Right. Okay, great. Thank you for sharing that. Very interesting. I need to back up to the quarantining and contact tracing question. I promised a friend I would ask this. So any ideas or suggestions on what to do about our club or team sports, after school activities when dealing with quarantining? If somebody is aware that somebody is positive and they're participating, is the health department involved in that kind of contact tracing? Or is it just in the schools?
No, we will be involved in case investigation for any kind of scenario involving our school district. As a matter of fact, I'm sorry I missed a couple of minutes of the presentation, but I'm sure Marc mentioned that because there's such an overwhelming number of cases and over 2,400 close contacts just recently within the school system, we don't have the staff to, do tracing for every single person. So we do prioritize and we try our best, and we're trying to hire additional staff. But our priority is the school system without question. And that is our commitment. But yes, any case to be investigated, we don't care if it's in the school. We don't care if it's as a result of
it's like PAL baseball.
It doesn't matter.
Okay.
School is priority, period.
Very good. The other question that comes up a lot in regards to testing, right? A lot of parents are doing home kits, home testing. You can go to CVS. I did this with my own son. You can go to CVS, you can pick the box up, the 2 kits, you can do it. Is there any expectation of parents who are doing the at-home testing to call and report to the health department?
No, that is not a requirement by statute or protocol. However, we do we do encourage moms and dads, if you can get hold of that Abbott rapid testing kit, please use it. Like what Dr. Tucker just mentioned, he uses it for himself and his family for surveillance purposes. I did the same. When I was a breakthrough case 6-7 weeks ago, I went right to the drugstore, bought the kit, and realized, oh my gosh, I was vaccinated back in January, but I just got COVID. And the test was accurate with the symptoms that I had. So no, you don't need to report it, but certainly use it for surveillance purposes.
Right.
You know, you use your common sense that, hey, if a child tested positive, you just keep that child at home and do your own contact tracing. Contact the people that your child or anyone in your household was exposed to for 15 minutes or longer within 6 feet. Contact your friends, contact your family like I did, so that you can just forewarn them and encourage them to use the Abbott rapid testing kit to play it safe and to remain healthy.
So does that
again,
mean the numbers could actually be higher?
Oh, yes, absolutely. Dr. Stephen Bickle, who has been researching this, Paul and Anthony know Dr. Bickle, and I mean, he's been researching this, and he says, take the number of positive cases right now that's in our community and multiply it ×3, multiply it ×4. And that truly is a reflection of the prevalence, the prevalence of positive cases in our community, because we're not catching everything.
Okay. And David, I know you well enough. I can read your body language. I think you want to say something.
I was just going to comment, just to clarify what Bob was saying. So all of our extracurricular activities, the sports and the clubs and anything school sponsored, we give that information to DOH. I saw there was a question there about extended day and things like 21st century. So they're doing that contact tracing for us, just like they would if it was a kindergarten class.
And so we want to be clear that if you have a child attending the school system, we really, I mean, it's okay to go and get the test and, for screening purposes, but it would be really important for you to confirm those results and be tested by the Department of Health, because that is what the school district is going by. Is that correct, David?
Yes, that's absolutely correct.
In other words, the school, or correct me if I'm wrong, will the school accept a CVS test result?
No, it won't. But what we do is we have that conversation with the parent, and we encourage them to reach out or to go to the health department and get tested, because again, we only respond to those confirmed cases through the health department.
Okay.
And that's why we're available, Colleen, for testing every single day of the week, 8 to noon, for that purpose, because a negative test for an asymptomatic student, staff, or teacher is your ticket to go back to school sooner rather than later. And that is, day 5, as Marc mentioned.
Sure. Okay, great. Thank you. Well, gentlemen, it's 8:30. I have definitely maxed out the time with all of you this evening, and I'm sure our audience, but I can't tell you how much I appreciate you taking the time to participate in this discussion. So we'll do a round of final words. And I would ask, in closing, what advice would you provide our parents? I think you've given it pretty clearly tonight, but just a recap of how best to keep our students and our staff safe. And why don't we just go right around the room there? How about Dr. Tucker? We'll start with you and then go to David and then Bob, Marc, and then Dr. Mucciolo.
I think this has been very informative for everyone, honestly. I think my recommendation is to do everything you can to help keep your children and your friends' children and your family's children safe. And that's wear a mask, social distance, make sure they're washing their hands, make sure they're not chewing on their fingernails. Kids do that a lot. And get vaccinated if they're over the age of 12. Those are all the things you can do. So you want to do everything you can to give them the best chance at success. And unfortunately, right now, success also means survival.
And I am sharing the screen because I know you're very passionate about this letter. And
yes.
So you want to share very quickly what this letter is that the audience is looking at.
So this letter is actually from every national children's hospital that's world renowned, and they're well known all throughout the country. If you'll look at the second name on the list is actually from Wolfson's Children's Hospital in Jacksonville. And this is what they're recommending. All right. These are not just Dr. Tucker, the ENT with, 3 stars on Facebook telling you this. This is the truth. This is what's true. All right. Everyone out there that knows pediatric medicine is recommending for your children to get vaccinated if they're old enough, to wear a mask, and to practice social distancing. I'm pretty sure they know what they're talking about.
Thank you. Thank you for that. Definitely appreciate it. And David, and I'll share this letter for those who are interested on my Facebook page. Thank you for sharing it with me.
Yeah, I think my ask to parents would be, if your child's sick or if they're not feeling well, please keep them home. Our staff will work with you to make sure their work's getting caught up. We ask that our students and our staff do daily health screenings prior to coming on campus. So just work with us, take that time to do it. And if you're unsure, err on the side of caution, keep them home. Like I said, we will work with you, and just know our school-based teams and our departments are working nonstop to make our campuses as safe as possible. We may not always agree on what the best way to mitigate risks are, but let's do the best we can and work together. And I do believe, we'll get through this together.
Excellent. Thank you. Bob?
My main message is please implore everyone to get vaccinated. I trust people like Dr. Tucker. I trust people like Paul Mucciolo, and the medical experts in our community, Dr. Stephen Bickel, and the virologists around the country who have researched and studied this disease and virus for many, many years. Please, please get vaccinated. Do this for yourself. Do this for your loved ones, your neighbor, stranger, family, friends, parent, grandparents. Please help us just stop the chain of transmission. And that's how we're going to reach herd immunity. And that's how we're all going to be safe and healthy. And if you got any questions about the vaccine or questions that are still pending in your mind, please reach out to medical experts, and please don't rely on the disinformation and just the bad stuff that is on the internet right now. It's a real shame.
Well, thank you, Bob. I appreciate it. Hopefully tonight we were able to share additional information with folks. Marc.
Yes, thank you so much. So I just want to say, if you're wondering what you can do, take personal responsibility. You can wear a mask. You can social distance. You can wash your hands. Your children, who may not always make the best decision for themselves, you can help them understand why. Maybe children don't always have a bad outcome, but that teacher in their class fighting cancer, somebody else having difficulty, that can drastically affect their life.
Thank you. So true. And Dr. Paul. And again, I am so grateful to you personally for coming together, setting aside any political differences, joining and co-hosting this panel in an effort to share information with the community. So from the bottom of my heart, I truly appreciate you and your efforts and your expertise. So thank you.
Oh, that's very kind, and I'm honored to be part of the panel. To cap this off, everyone has to understand that prevention is the name of the game. There's no treatment. Get your shot, wash your hands, wear your mask, social distance. And the important thing is to clean more frequently, because it doesn't take a PhD in epidemiology to figure out that children who are impoverished, children who are disabled, bear the greatest brunt of the pandemic, because the young, the developmentally delayed, and the special needs children have no other option than their special education programs in the schools. So if there's a motor, neuropsychological, or sensory problem, that creates special problems because, as one of the panelists said, they put their hands in their mouth, they touch things, and their fingers go in their mouth, especially when they're young. So their airborne risk that we're all concerned about becomes equivalent to the risk from a contaminated surface. So that's very important to emphasize that. And as a community, let's work with Flagler schools and the Flagler County Health Department to stop the revolving door of quarantine and the attrition of the staff. And as a parent, just as a personal end, I would like to see a re-exploration of a remote learning option and temporary mask mandate, with the understanding that let's all put aside our personal and our political beliefs and put the group first that we're here for, which is our children.
Thank you. Thank you. I appreciate it. And again, I want to thank the community for chiming in, and we will go back and I'll read all of the comments. I'm sure they're interesting on my Facebook page, as they always are. And in closing, I guess I will just share with you this. We all want to learn to live with whatever variant we're dealing with today, or may end up dealing with tomorrow. And no one, I can promise you, and I repeat, no one wants to shut our schools down. The schools are the backbones of communities across the country. And not only are they providing an engaging learning environment, but they're also providing a critical service for our community. How or why this has become political or so divisive is beyond me. The science is pretty overwhelming. The recommendations, scientists, researchers, healthcare providers, governmental agencies, physicians, and nurses, those debunking this science are well within the minority. These strategies have been deployed by the military for our troops, hospitals for our nurses and our doctors, airlines and airports for those working in the industry and for travelers, legislative bodies across the country and in the nation's capital. Precautions, layered mitigation have to be put in place for all of those. They are in place for all of those entities, but we want to demand choice and freedom when it comes to our children. I would just ask you, if you're a parent, are you a epidemiologist? Are you a physician? I'm not. I'm a parent, but I'm not an expert in those areas. I'm going to rely on folks like joined us on our panel tonight and those that are making decisions for the greater good. This issue is very, very real for us. We all know someone that has been taken by this virus. Opening up Facebook has become almost a daily nightmare because you don't want to see who's been lost. Again, no one on our team in Flagler Schools wants to lose another team member like we did last year with Tom Russell. And I always feel it is critically important to honor his memory by speaking his name. God forbid the loss of a child. So this isn't about fear mongering. Tonight was really about saying, hey, we are all on the same team. This was about sharing information, trying to provide you with whatever we can do to educate the community. Because yes, like Marc mentioned, it is going to come down to personal responsibility. That's the freedom of all of this. But at the end of the day, we have to be responsible as well for each other and for the public good. And so I encourage you, if you can, to get vaccinated. I encourage you, if you can and your child can, to encourage the wearing of a mask. Wash your hands, keep your distance, and together we can all get through this. But I hope you found this evening informative. I'm sure there are some people that are not pleased with the discussion, but hopefully everybody learned a little bit something more than they did before they tuned in. So again, I just want to thank the panel. I really appreciate your expertise and your time and your commitment to our community and for the betterment of our students and our staff and our families. So again, thank you very much.
Thank you.
Have a great night. And to the audience, thanks for joining.
Thank you so much.
Good night.
Bye. Bye.
Thank you.
I hope it recorded.
It did. I'm sure it did.
Okay. See you, Gretchen.